Keith, you and I are in a similar situation because my 27-year-old son came to stay with me, and I'm so grateful that he and I are spending this time together. But, he obviously had independence before he came to stay at home with me. And so I think for those of us who have adult children that are not finding themselves back at home with the parents, it's a totally different dynamic. And so I wanted to ask you, how has your family situation changed following the shelter-in-place policies? And how have those changes shaped the way that you think about how you provide support and care? And I think it has to do with, where you are in your life, as well as where your children are and those that you're caring for.
I think sort of as a baseline for our situation is that my wife and I are both working from home. So that removes a whole layer of stress. So that sets a very stable base. It's interesting. My daughter has had to come home, and my son can't leave home. That's kind of the short version of it. My daughter was living out in the suburbs and had a good job and was starting to, move from a house sharing situation to a real apartment lease. And she was able to work at home for a little while, but then they laid her off, and that's, very traumatic for anyone that's, for anyone, but when it's your first job, and it was done in the kindest of ways where, she expects to be able to go back. It was a temporary furlough. It wasn't being, but still that was a big hit for her to take. And she did that while she was basically staying by herself in a temporary situation, working from home. And so as soon as she told us that she was laid off and she had to take her office machines back to the, and we said, well, you're coming home. You've been living by yourself for 3 weeks already. We're gonna merge these circles of safety here. My son had a little bit different. His situation was different. He had been out of the city for a summer job that he knew was going to wrap up, and so came home in the fall and began some part-time stuff and some volunteer work with one of the local museums. That's a career direction for him. And he was just starting to get a part-time job going and starting to make plans for getting an apartment of his own in the fall, and so that sort of all came to a grinding halt. And so he's kind of have to reassess that and realize that he may be here longer than he was hoping to be. And as I've described, we have a pretty functional, pretty happy grouping here, but he's 23 years old. Would he rather be living by himself or with his friends than his parents? Yeah, he'd much rather be out on his own. And those are the two biggest changes, is that my kids' trajectories have had to get put on hold.
Thank you, Keith. So Lisa, I'm just curious, what are you hearing from the millions of caregivers that the Caregiver Action Network serves? So, and what are the most pressing needs that people have that they've communicated to you? And how are you helping to solve those?
Oh, great. Thanks, Mary. So caregiving is a very isolating experience anyway. A lot of caregivers report isolation and depression under the best of circumstances. So now during the pandemic, you add the regular intentional social isolation to caregiver isolation, and people are feeling exceptionally cut off from their communities. The other thing that we're hearing about is, caregivers are also, people just like you and me, and people are getting very concerned about financial distress. So if you're a caregiver and you have sadly lost your job or experiencing decreased income due to the pandemic, there's a lot of concern about that, because even before the pandemic, being a family caregiver could be very expensive. So those are two key things. And the other is depression. So we are working with caregivers. We are directing them to depression screening tools and to trusted resources for their own depression. For the social isolation, we have, of course, our online, completely anonymous family caregiver forum. And we also have all sorts of ways that we can connect caregivers to each other and to other help. So for example, our caregiver help desk is always there for them. And some of the staff at the caregiver help desk are also skilled and experienced to provide some up-to-date COVID advice related to some of that financial distress as well. So we're really trying to step that up and help them that way.
That's great. Thank you so much for sharing those resources. And Vicki, going back to your community about moms who are sandwich caregivers, meaning that they're caring for oftentimes children or homeschooling now, and then maybe older parents. What are these caregivers sharing with you that are kind of stuck in that middle space? You know, the other thing I wanted to ask you is, I know it's the joy of mom, but I imagine that it's not just for women. Am I right?
Yeah.
So I just wanted to open that up and just give you an opportunity to kind of share some of those insights.
They are definitely feeling the weight, the stress of being in a sandwich generation, for all that we normally have to do to be fearful, as Lisa just said, with diminished income or income going away. It's surprising how I'm so proud of everybody, because I know how stressed so many are and how they're really doing all they can to show up and stand up and be the warrior that they need to be right now. A lot of them are not able to go see loved ones. My daughter's best friend, who lives in Spain, her grandfather just passed away. Nobody could travel for the funeral. She lives in the same apartment building with her soon-to-be in-laws. They can't see each other. Most of the families had COVID-19. It's shifted from the support, the physical, if you will, that we normally have, has turned into much more of a community support. And our moms always say this is, they call themselves, this is our tribe, and has been such a lifeline to them, going on 5 years, 10 years of me having Joy of Mom, but 5 years of me doing live streams, which is a big way we're able to connect and see everyone. We have women, we have moms, we have grandmas, we have dads, we have single dads, we have married dads. It's mostly women and moms, but we do have a fair amount of dads that are very active and super fans, if you will. And everyone's welcome.
I'd love to jump in and just build on something that Vicki was saying, because underlying all of that, Vicki, is that you've got this huge community of people who have done the first most important thing. They've said, yes, I'm going to reach out for some help. And that is so important. And at Caregiver Action Network, we're always trying to teach people not just that they need to reach out for help, but also how to ask for it, how to accept it. Because accepting help, if you're not used to it, it really be hard to do. I mentioned I'm doing some caregiving now, actually a lot, for my dad. And some of my friends, were on WhatsApp and they're like, oh, what can we do to help? And they've rallied around. So when I'm off trying to deal with my father, they're feeding my husband and son. And I've never been somebody who has asked for that kind of help before. And they just offered. And sometimes just accepting help from friends, whether it's virtual or a meal, can just fuel you. So kudos to you, Vicki, for having a community of people who have asked for help. And I just want to encourage everybody who has never done that before to reach out and get some help. It's energizing.
I've never asked for help. And now moms will say, you'll never ask. We know it, but we're here. We're showing up. We're, whatever you need, not on my watch. This isn't happening. You should see how we rally around anti-bullying. You can only imagine.
That's wonderful. I love it. Lisa, I wanted to ask you specifically, Caregiver Action Network is it's really agnostic to any, condition or diseases that people are caring for. which I think is great because it's really that shared experience amongst caregivers. I wanted to just ask you, because one thing that we haven't talked about is there are a lot of millennial caregivers coming up in the world, right? I've heard of statistics of, upwards of 25% of caregivers are now millennials. Do you have any special advice for them or any other demographics or groups in terms of not only providing care, where they can go for resources? Because I think that's another thing is we don't have an idea of what's credible, what's good, what's right information in this day and age where everybody can opine about a lot of things. So how can you help to guide those that find themselves for the first time in their lives, whether they're millennials or older, where to find the right help?
Oh, great points, Mary. So many great points. So yes, millennial caregivers are really stepping up. Some of them are what we would call the stereotypical sandwich generation. So maybe it's a millennial with young school-age kids caring for a parent or another loved one. Sometimes it's people who are older and have older children are caring and are still millennials. But we're also seeing, along with the millennials, a huge, and now with the pandemic even growing larger, cadre of what we're calling youth caregivers. People who are 16, 17, 18 years old, 22 years old are now the caregivers because they're the people who are right there. Now, if we've got a home where, as Keith was talking about, people moving back into the house, well, we've got a lot of people who their elders are moving back into the house. So we're having grandparents in the home, parents who are millennials or older, working virtually for the first time, and youth caregivers now all trying to work together in one environment. Or if you've got school-age kids in the house who need a very stimulating environment, and maybe somebody older in the home with that millennial in the middle, trying to provide a calm, soothing, familiar environment for an older loved one while stimulating the youth. I mean, this can be just really crazy. So we're seeing a lot of changes in that profile of a caregiver. Now, in terms of trusted resources, that's key. That's really Caregiver Action Network, what we're all about. We don't have all the answers, but we're going to help you find the answers that you need, and we're only going to make sure that you go to a trusted resource. So the easiest and best way to do that, if you're looking for help, is to connect with us through the Caregiver Help Desk. A few key things here. The help desk is totally free. You contact the help desk as much as you want. You don't have to pay for it. All resources that we provide for caregivers are completely free. The other thing is that the Caregiver Help Desk, you can access that through a toll-free number. You can go to our website and click and do a chat, or you can also send in an email inquiry. So you might be saying, hey, I'm a millennial caregiver. What can I do? Where can I hook up with people like me? And the help desk will be able to provide you that information. There's also resources about that on our website, but we really are finding, especially now during the pandemic, having that live connect with somebody. You can reach out to one of the help desk staff members and talk with them. It can really help. So we want people to be able to do that as well.